So overactive bladder is very common in the general population. It can affect men and women. It's generally described as a sort of constellation of symptoms. So it can include urinary frequency, urinary urgency, nighttime urination, and it could also include leakage. It's been estimated to affect up to 1 in 6 adults. So that's actually more than people who have diabetes. And the main thing is that it can be very bothersome to patients. It can be socially isolating. It can cause them to not spend time with their family, with their friends, go out, do things. And unfortunately, a lot of patients suffer sort of silently because they don't know that there are options that may be readily available to help treat their symptoms. Oftentimes, there are no clear causes. It could just be an individual patient, almost bad luck, or there may not always be some underlying etiology. It could be related to medications. It could be related to certain behaviors. So sometimes we'll see adults who report that when they were in adolescence, they would hold their urine for a long time, and that can end up being something which affects them, or teachers or people who for a long time, because of restrictions at work, aren't able to go to the bathroom. So they may have overactive bladder symptoms. It can also be related to certain foods, to certain bladder irritants, caffeine, alcohol, spicy foods. Those are sort of some of the main culprits. But oftentimes patients just have it and it progresses over time, and there's not always something clear, an offending agent that we can just eliminate the symptoms. So what I tell all patients is that it's a stepwise approach. It starts from step 1, which is behavior modification. So that could be things like timed urination, avoiding some of those bladder irritants. When you have the need to go, maybe not going right away. And it also includes physical therapy, so pelvic floor muscle therapy. That's sort of step 1, conservative behavioral therapy. Step 2 are medications. And there are a number of medications that people can take. Some of them help relax the bladder. Some of them help decrease the contraction of the bladder. But these may be associated with side effects. Sometimes there's patient compliance issues. If they're already taking a number of medications, they may not want to take additional medications, or they don't always work. So that brings to third line, or advanced therapies, of which there are 2. There's Botox for the bladder, which is an office procedure every 6 months where we inject Botox. So this is the same medication that people sometimes get for migraines or forget to get rid of wrinkles in the face. And it's injected in the bladder in the office setting. And that is a 5-minute procedure, and that lasts typically 6 to 9 months. But the other option that I do a lot of is InterStim. InterStim is, I call it like a pacemaker for the bladder. And it's done first as an office test, where we put a temporary wire in the back just under local anesthesia. That's done in the office. And the theory behind why this would work is it's really regulating the communication between the brain and the bladder. Sometimes those pathways can get out of whack, and the bladder gets a signal from the brain that you have to go urgently, even though there's not much urine in there. And by regulating that and creating normal communication between the brain and the bladder and back to the brain, you can control it. So the first step is an office test, which can be as easy as 10 minutes in and out, where we put a temporary wire in. Over the next 3 to 4 days, the patient will assess the improvement in symptoms and determine if their frequent urination, urgent urination, nighttime urination, leakage gets better. And if it gets better, we can then do a permanent implant, which is a quick procedure in the hospital. And the only reason to be in the hospital is we need X-ray at the time, and we put a permanent battery in that can last anywhere from 9 to 12 years. When patients come to see me, it's often after they've failed medication or after they've decided they don't want medication anymore, and they don't necessarily want something like Botox that requires them to come in twice a year. They want to sort of set it and forget it. And for those patients, I think the InterStim device is really perfect because it has a very high success rate, north of 85%. I tell the patients the new battery lasts 10 plus years for most individuals. I tell them that it's MRI compatible, so that used to be a concern, but it's no longer. It's not going to set off metal detectors. It's not going to set off security alarms at the airport. And it really is something that also allows us to test before we do something permanent. So I really think patients like the idea of proof of concept. You can do an office test with almost no side effects to see if it's going to work. And I've had patients come in after having that office test and say, I haven't had a solid night's sleep in 10 years. And that was the first time I really made it through the night. That was the first time I didn't have to go through 3 pads. I feel like a completely new person, and they cannot wait until they get the permanent implant. So those are really the patients who I think I would talk about it to. And those are the patients who seem to have the most dramatic and pretty rapid improvement in their quality of life.